John is friendly, bubbly guy, outgoing, lovely, and caring, and joyfulness. I don't know, am I saying it right? Joyfulness. I'm always, and I have that sparkling smile. I love to smile a lot. And, I did love myself.
All right.
Achievable is a federally qualified health center, and what makes Achievable unique and special is that we work with individuals with developmental disabilities and their families in our health center, along with other vulnerable populations that we work to support as well.
My doctor is a powerful woman. She is really sweet, caring, and I'm grateful that my doctor is in my life.
The pandemic definitely presented some challenges and additional hurdles. We've had to make major pivots in the modalities and vehicles that we use to deliver services to our client population. There's other additional considerations that have to be made anyway when we're talking about the population of those with developmental disabilities, because typically they are supported by a number of people that have to be involved. We call it a circle of support or a care team. So getting all those players in line while we're trying to provide medical services or psychotherapy is a challenge. And during the pandemic, it's doing it virtually. Behavioral health is so much about connection. And I think it's specifically for individuals with developmental disabilities, that's always been a struggle. Like, how do we integrate these individuals so that they're not othered? How do we create community? How do we educate the general typical functioning population so that there's not this fear about someone presenting differently? I think that the biggest thing that I'm proud that we've been able to do is rally around really innovative and creative ways to lessen the blow of feelings of isolation. And so we've created groups online. We've figured out strategic ways to plug people into touch points. And what's been cool is that some of our patients have been able to connect with people they wouldn't be able to connect with before because we can do it virtually. Historically, the assumption was that individuals with developmental disabilities aren't able to participate in services like psychotherapy. And I think that we have really shattered that notion with what we're doing in our health center each and every day. And I'm really proud of that work. I know that it will impact the industry of behavioral health in our local area and abroad.
It shouldn't take you long to realize if someone is good or not, because I've been through counseling before and I just felt that connection there, and I said, okay, this is a good start right here.
There aren't many agencies, federally qualified health centers, that do what we do like we do it. And I think it's worth pausing and acknowledging these services are unique because we study to make sure that they're equitable for our patients and their families who are impacted by developmental disabilities.
Achievable is great because they have everything here. I mean, we've came to here from our regional center, and I find that they have the great doctors here. He's able to come here and get his shots, and they, work with him.
Really proud of the work that we're doing for our client population, not just those with developmental disabilities, but our entire patient population. Achievable is just really like a one-stop shop where they can get all their needs met from a medical point of view, but then also in their behavioral health services as well.
I really like these people.
Everyone is really nice and pleasant, and I see how they, interact with him. So I feel really good about Achievable.
Achievable Foundation, they are great. They're awesome, amazing, incredible. I'm grateful I found this Achievable Foundation. If I tell a stranger what doctor you should choose, I'll tell them you should choose Achievable sedation.